A few days ago, I read in the British Medical Journal a special article on a drug used to treat diabetes and the side effects of the drug. All drugs, even over-the-counter non-prescription drugs, produce side effects. All of us know about it. Why should an article be written on side effects of a common drug by a renowned research team and be published by the British Medical Journal? There is a reason. The side effect of this particular drug is bladder cancer. Pioglitazone is very effective in the treatment of type 2 diabetes. It belongs to a class of drugs called thiazolidinedione that help in control blood sugar levels in patients with type 2 diabetes. A trial unexpectedly showed an imbalance in the number of bladder cancer cases with pioglitazone compared with placebo. The use of a similar drug, rosiglitazone, was not associated with an increased risk of bladder cancer in any analysis, suggesting the risk is drug specific, that is, pioglitazone specific and not a class effect. This drug has been prescribed to millions of patients with type 2 diabetes in the last 10 years. How many of them had been affected by bladder cancer? In other words, how many of them were victims of partial knowledge? The partial knowledge treated diabetes effectively, but it gave bladder cancer. I come from a family of medical doctors. There are more than 20 medical doctors in my extended family. I have some knowledge about how doctors think and treat patients. My extended family members are all experts in their respective fields. They are experts in treating the disease. I am not sure whether they are experts in treating the patients. Our friend Alberto Zuccani has said more than once in the previous courses that medical doctors do not relate to the patients. They relate only to the disease. Alberto feels sorry that many doctors are licensed without receiving any training in managing patients or family relations. Ayurveda medicine is a system of medicine with historical roots in the Indian subcontinent. Globalized and modernized practices derived from Ayurveda tradition or a type of alternative medicine. A study says 80% of Indian population uses traditional medicine. 80% of 1.2 billion Indians. Allopathic medicine is favored by 20%. Some researchers consider Ayurveda a proto-science. That is, it belongs to the earliest periods of the history of science when the scientific method was embryonic. Ayurveda is open to the criticism that its conceptual basis is obsolete and that its contemporary practitioners have not taken account of the developments of modern medicine. Ayurvedic medicine is considered pseudoscientific on account of its confusion between reality and metaphysical concepts. I'm not a medical expert. I'm not going to suggest that Ayurvedic system is more effective than allopathic system or some other system. The system that works for the patient is the best system. What differentiates Ayurveda from others is its approach based on integrated knowledge about the patient. Ayurvedic doctors regard physical existence, mental existence, emotional existence, and personality as a unit, one integrated unit, with each element being able to influence the others. This is a holistic approach used during diagnosis and therapy and is a fundamental aspect of Ayurveda. Ayurveda takes into account all aspects of human existence. Its textbooks talk about disease, diagnosis, drugs, and treatment, just as the textbooks of other systems do. In addition, Ayurveda textbooks include discussion on philosophy, sociology, spirituality, and many more. This is something other systems don't do. The Ayurveda treatment is not based on pathological factors only. Treatment takes into account the whole of the patient, not just the affected parts. I like the integrated approach of the Ayurveda. With so much of advancement and resources at its disposal, will it not be possible for the Western medicine to embrace an integrated approach? In allopathic medicine, health is conceived primarily in negative terms as the absence of disease. In Ayurveda, health is conceived in positive terms as the property of a balanced and harmonious living organism. This becomes even more evident when we take into account psychosomatic phenomena. Research on the placebo effect dramatically demonstrates the impact of the patient's attitude and expectations on treatment outcomes and general health. Recent findings indicate that the placebo effect is increasing over time. This and other phenomena directly connecting physiological and psychological processes testify to the need for a much more integrated conception and approach. The remarkable integrality of the human body is an excellent example for integration of knowledge. Whose knowledge? Certainly it is not the human knowledge. It is the knowledge of the nature. Medical science has created an abstract conceptual framework to represent the functioning of the body. The body is divided into anatomical structures and physiological functions. The structures include cells, tissues, organs, and systems. The functions include respiration, digestion, circulation, and reproduction. But these classifications are abstractions. There is no such system as the circulatory system, distinct and independent of the skeletal, muscular, nervous, and lymphatic systems. Each cell, tissue, and organ is an integral component of the body. The functioning of each type is also integrated with the functioning of other types. A prick of the surface tissue of the finger may evoke a response from the skin, blood cells, heart, brain, glands, circulatory, nervous, and lymphatic systems. As the placebo effect and other well-documented neurological, psychological, and sociological phenomena testify, the body's physiological functioning is also seamlessly integrated with a host of other factors. Nutritional intake, physical environment, physical activity, sensations, emotions, and beliefs of each individual. The limitations in prevailing conceptual models of reality hamper efforts to pass beyond an aggregation of physical parts and functions to a truly comprehensive integral conception of health. In medicine, specialization has led to remarkable progress in our understanding of specific pathologies, but it has taught us relatively little about the overall concept of health. The peaceful treatment of specific illnesses often has consequences quite detrimental to the overall health of the patient. Our present fragmented knowledge may be inadequate to guide the further evolution of human civilization in this area. This is not an indictment of the vast, accurate body of specialized knowledge generated by medical science up to now. This is rather a realization that more of the same will not suffice. Relativity theory did not reject the principles of Newtonian physics. Rather, it placed them in a wider context in which their limits became evident. Thank you.